Hello friends, I am Dr. Jaydev Panchwagh. I am chairman of Synapse Brain and Spine Foundation. I am a founding member of Neurochirurgy Hilfa Indian, which is an Indo-German neurosurgery foundation. I am practicing neurosurgeon in Pune, in India, for the last 20 years, and I am consultant neurosurgeon at Sahyadri Hospital, Pune. I want to talk about the topic which is very close to our heart and on which I personally have been working for the last 15 years with my team, and we have perhaps the largest single team experience in this field. Since 2005, we have been treating a disease called as hemifacial spasms with very focused energy. I will tell you why we are doing it with such a focused attention. First, let us know what is hemifacial spasm. The hemifacial spasm is involuntary repetitive movements of one side of the face. Now, since we don't have a patient here, I will just enact them. Usually it starts with blinking of one eye like this. Suddenly the blinking starts, and after some days or months, this blinking spreads to the cheeks. So usually patients, while speaking, this is what happens. Now, suppose I have hemifacial spasm speaking to you, I'll be speaking like this. Okay, so this is very clearly demonstrable disease. So if it happens on the right side, then while I am speaking, this will be the movement that happens. Usually, these symptoms start with the lower eyelid. There is a flickering movement repetitively in the lower eyelid. It spreads to the upper eyelid, it spreads to cheeks, and then this muscle, which is called as platysma muscle in the neck. This disease, though it looks very funny, if you look at a person who has hemifacial spasms, it looks very funny. However, for that person, since I have been speaking with these people for last 15 years repeatedly, I have understood that for them it is a horrible kind of a disease, because the society doesn't know about this disease. If they are walking on the road, if they are attending a meeting, if suppose they are working in some company and they are sitting as receptionists, then just imagine that when they are speaking, this happens. What will happen to their confidence, and what will happen to other people's opinion about them? Also, as the disease worsens, and it surely does in many cases, there are physical disabilities which come. There have been people who tell me that they cannot drive because hemifacial spasms. They cannot watch movies. They cannot concentrate on computer screen even while they are working. Some people cannot sleep, insomnia, because as soon as they go to sleep, suddenly the spasms start and they wake up. Typically, though, these spasms increase in slightly tense situations. Suppose they are meeting a stranger, or they are giving a speech, or any tense situation, they increase in intensity. Some of these patients have actually confided in me that they have some point during this disease seriously considered committing suicide. So this is the trauma it causes to people. And lamentably, very few people know the correct things about this disease. In majority of the cases, now I don't want to go in great details because there are very rare medical reasons for this, but in most of the cases, this disease happens because what is called as neurovascular conflict. What is neurovascular conflict? Now, forget about this big word, Simply speaking, each side of the face is controlled by one facial nerve. So, if I want to move my cheek on this side, my right-sided facial nerve, which is coming out of the brain and supplying the facial muscles, will get activated. I will activate it voluntarily. Now, in these people, there is a blood vessel which is positioned very near to this nerve from birth. As age advances, the length of this blood vessel goes on increasing. It is called as ectasia. Now, this happens in all of us. Ectasia is a process like graying of hair. So, if you look at an elderly woman, you will see her blood vessels as corkscrew-like blood vessels because they have become elongated. So, if the blood vessel is near the nerve and it elongates with age, it will bury deep into the nerve. So, suppose this is a nerve and this is a blood vessel, it will bury deep. And what do blood vessels do? They have pulsations. So with each pulsation, it is hitting the nerve. So this is called as neurovascular, nerve and blood vessel conflict. So they are in conflict with each other. So with each hammering, the nerve gets damaged, and as it gets damaged, the spasms start. With age, the vessel again further elongates and burrows even deeper into the nerve, so the spasms become worse. So this is actually the cause of hemifacial spasms in people who have neurovascular conflict, which is the majority of the people. And the surgery for that, which is called as microvascular decompression, had gone in disrepute because of many reasons. We realized that since it was not being practiced in a focused manner by a dedicated team, maybe the results were not too great. So we decided to focus our energies in 2005 on this particular disease along with trigeminal neuralgia, about which I will speak afterwards. And we were able to develop this team and operate on these problems repeatedly. We have proven, and we have presented this paper in the recently conducted Australasian Neurosurgery Conference, that excellent results with MVD surgery with a dedicated team of nearly 99%. And we are all very happy to see the change it brings on these patients' faces. People who were really very, very shy to go out and live their life suddenly become confident, and we are extremely happy. I want to share this experience because I want everyone to partner our team in spreading this knowledge amongst people, that it can be cured. There are other methods like Botox. Botox is a injection which, when given, paralyzes the muscles temporarily for 2 or 3 months. It is like applying a band-aid on a deep wound. So nothing else. You are not treating the wound. Botox will mask the spasms for 2 or 3 months. The spasms will reappear. Not only that, while you are under Botox effect, the blood vessel which is elongating and further dipping deep into the brain will keep on doing so. So when the Botox effect wears out, the spasms which come back are even stronger, and next time even stronger. So the disease is increasing inside. We are trying to pacify it from outside. So that is why, according to our opinion, by going by our philosophy, we feel that MVD is the best solution. The disease has to be cured in time. It should not be taken lightly. Many people say, oh, it's only spasms, don't do anything. But for that person, the sufferer, it's a big deal. It's the whole life that is completely affected by this malady. So we have to understand that. And we have to give them this option. We have to give them this option that there is a specifically focused kind of work going on. This information, I think everybody is entitled to that information. Final decision lies with the patient. But friends, please remember, hemifacial spasms can be treated and should be treated as early as possible to prevent further problems. If you have any questions about this, please write to us. This subject is very dear to me and my team, and we would like to really eagerly respond to you. So don't hesitate in contacting us. Thank you very much. I am Dr. Jaydev Panchawagh, and keep seeing this channel. Keep asking us questions. We'll try to make videos on this, and thank you again.